standing by. Welcome to the Soup to Nuts Designing a Healthy Food Retailer Certification Program webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this webinar is being recorded Tuesday, April 22nd, 2014. I would now like to turn the webinar over to Rio Holiday, Policy Analyst. Please go ahead.
Hi everyone, my name is Rio Holiday and I'm a Food System Policy Analyst here at ChangeLab Solutions. I am joined today by my colleague Malia Schultzman, a staff attorney with our tobacco control team. For those of you who aren't familiar with ChangeLab Solutions, we're a public health policy organization that works on policy solutions to public health problems. And this webinar is the second in our year-long series of healthy food retail webinars. And we're really excited to be joined today by 3 program staff from the Eat Fresh, Live Well, Healthy Corner Store Initiative in Toledo, Ohio. We have Amy Abadili, Tony Maziars, and Bethany Deakins with us. So here's a brief overview of what we're going to talk about today. I will discuss the elements that make up a strong healthy food retail certification program. Malia will share a couple thoughts on incorporating tobacco control into a certification program. And then we'll spend the rest of our time talking with Tony, Amy, and Beth. And we decided to have some fun with presentation style. So they will give a short presentation about the nuts and bolts of their program. And then I will get to interview them on lessons learned, best practices, and things like that. And I will incorporate questions from the audience into the last 10 minutes or so. So please type your questions into the chat box. It's a pretty packed webinar, so without further ado, let's jump right in. Now, because we work with lawyers, I do need to let you know that ChangeLab Solutions is a nonpartisan organization that does not provide legal advice. And now that we've got that out of the way, let me start by orienting you to this idea of a healthy small food retailer certification program. So first, what do those terms mean? When I say small food retailer, I'm talking about food stores that have a limited physical space and limited selection of food. And different communities have different names for these stores, including corner stores, convenience stores, gas stations, and dollar stores. Now, what's a certification program? So there are a number of types of food retailer programs out there. And they vary greatly in terms of the size of the geographic area they're targeting, what types of materials and assistance they offer, how formal their agreement with store owners are, and that sort of thing. And a certification program is the most structured of these programs. So food retailers apply to the program, agree to meet defined standards, and in exchange receive benefits or incentives. And certification involves a formal contract between the store owner and organization running the program, as well as some degree of monitoring compliance with the standards. So on the spectrum from program to policy, which we covered in the previous webinar, a certification program falls between operating a healthy food retailer program and developing an incentive policy. It's our gold standard for a program, and it's a great launching point for communities that are interested in taking the next step to policy work. Now, it isn't for everyone. I know that a number of people listening in are just starting out and may be in the yellow or orange boxes on this screen. But the purpose of this webinar is to describe our gold standard, and then you can decide how to tailor it to your community or keep it in mind as a goal for when you're ready. And we at ChangeLab are more than happy to help you with that process. So a strong program needs to have a well-defined scope, by which I mean 2 things mainly. So first, you want to define the geographic areas that you plan to target. And most programs consider things like low-income neighborhoods, high-traffic areas, and proximity to schools. Some target specific neighborhoods, others target entire counties. It's really up to you. And you also want to identify the type of store and store owner that you want to work with. And this is really important. We provide technical assistance to a number of healthy retail programs. And whenever I ask what makes a store sustainable, people always mention the store owner, how invested they are and how much capacity they have to make and maintain changes. Now, I know that recruiting store owners itself is a huge task, and it's often most feasible for programs to work with any store owner who's willing to participate. But as you consider a certification program, we really suggest being more particular about what type of stores and store owners you work with. So for example, you might look at business data and sales data to pick out the stores that are already healthy from a business sense. And this all comes back to sustainability, right? Your program is only as strong as its weakest store. So if you start with stores and owners that are interested, have the capacity to make changes, are financially able to take the risk, as they see it, of selling apples for a few weeks, then you're already starting out ahead. Now, one of the most important parts of a certification program is the standards that you require stores to meet. So strong, publicly disclosed standards ensure that customers have healthier options that they'll actually take advantage of, and also assure taxpayers and funders that their money is being used effectively. Now, that being said, your program needs to be feasible. Store owners have to be able to meet the program requirements while running their business full-time, and program staff have to be able to monitor them. So one way to ensure that your standards aren't too burdensome for store owners is to give them a choice of which ones they plan to adhere to. So for example, ChangeLab Solutions has developed a list of suggested standards, which you can find in Health on the Shelf, our 100-page guide to developing a certification program. And we have two tiers of standards. So Tier 1 standards are the bare minimum that all stores must comply with. And they range from stocking specific amounts of staple foods to posting signs or shelf labels that promote healthy products to providing adequate lighting within the business premises and throughout the parking lot. Now, Tier 2 standards are more difficult to implement, but stores only have to choose 3 options from this tier. And examples here include offering one sale, coupon, or other discount per month on any product that meets program standards, reducing the number of alcohol products by 20%, or removing all advertising for alcohol, tobacco, sugar-sweetened beverages, and junk food from one area of the store, such as the checkout counter, a single window, or the front door. Now, I also want to note that it's important to be aware of the federal, state, and local laws that food retailers in your area are subject to. So when you're developing your requirements and standards, you want to be aware of what legal constraints retailers have, and you also want to make sure that your requirements don't conflict with or duplicate existing regulations. And you can work with your local public health or environmental health department to figure out which laws apply to food retailers in your community, and also actually to determine whether retailers who are interested in participating have been cited for violations. And on that note, you might also make it a requirement of your program that stores maintain all licenses and remain violation-free as a condition for participating in the program. So how do you get stores to actually adhere to all these standards? Great question. Well, by providing incentives. And when we talk about incentives, it's really important to link the incentive to the change that you want to see. And ultimately, the incentives you provide should reduce the cost of compliance with your program standards and also build a store's capacity to sell healthy food without your help, right? So think of incentives as a short-term bridge that gets a store owner from their existing business model to a healthier one. And this gets back to sustainability. Your program shouldn't be designed to continuously hand out incentives. And so like program standards, you might consider offering a set of incentives that store owners can choose from rather than a one-size-fits-all package, because different store owners are going to have different needs, and some program requirements will be harder to implement than others. And of course, this depends on your program's capacity to offer multiple incentives. But some programs to consider include capacity building, like technical assistance and training on how to stock fresh produce, community outreach, like free marketing and publicity events, free or low-cost equipment, like refrigerators or display shelves, and financial assistance, like access to loan programs or matching grant programs. Now, I mentioned Health on the Shelf earlier, and you can find a list of suggested incentives there as well. And we also recently released a resource called Incentives for Change, which is specifically about incentivizing improvements to small food stores, and you can find that on our website or in the chat box. Now, another thing to consider here is approaching store owners on their own terms, by which I mean business terms. So we've learned at ChangeLab Solutions that if you frame your program as a public health program that benefits the community, store owners are more likely to think of the incentives you offer as charity that they don't need to work for. Whereas if you frame your program as one that will benefit them, they are much more eager to implement and maintain the standards. And one easy way to do this is to give the dollar value of each benefit you offer, whether it's a thing like a refrigerator or flyer, or a service like a cooking demonstration or technical assistance. So how do you actually enforce all of this? One great way to do this is to have an application, a contract that's signed at the beginning of participation, and compliance visits. So we recommend that a healthy retail program checks compliance by first periodically visiting the store and having a protocol that can be used consistently by staff. And secondly, requiring that stores renew their application every year. And so this ensures continued compliance, allows your program standards and incentives to change, and also takes into consideration that store ownership or management may change as well. If a store doesn't comply with the program standards, we recommend that program staff work with the owner to come back into compliance within 30 to 60 days. After that time period, the store should be removed from the program and barred from reapplying for a year. And the program should also consider asking the store to reimburse it for the cost of the benefits provided. Now, here's where the beauty of a contract comes in. All of this, eligibility requirements, standards, benefits, penalties, and timeframes, should all ideally be laid out in a contract and signed before a store officially begins its participation. And this creates an opportunity to acknowledge and have a conversation about these expectations at the beginning of the program so that no one's surprised later on. And with that, I will hand it over to my colleague Malia, who will talk about including tobacco measures into a healthy food retail program. So take it away, Malia.
Thanks so much, Rio. My name is Malia Schultzman. I'm a staff attorney here at ChangeLab Solutions in the Tobacco Control Program. And we've received several questions about how tobacco can be effectively integrated into a healthy food retail program. So my goal during this quick whirlwind tour of tobacco is to provide some quick ideas and examples to get you started. I think if you are interested in incorporating tobacco into a healthy food retail program, it's helpful to have an understanding of the type of promotions that the industry is offering to store owners. The most common incentives that tobacco industry reps are offering to store owners right now are price discounts. And basically owners participate in reimbursement programs with the industry, where stores provide a discount on certain brands of cigarettes for a specific period of time, such as 50 cents off each pack of Marlboros sold for 30 days. And at the end of that 30-day incentive period, the manufacturer will reimburse the store owner. And store owners participate in those programs because they want to stay competitive with their neighbors. They want to make sure that their cigarettes are priced just as low as their neighboring competitors. As a condition of participating in those programs, retailers are typically required to post some advertising at the point of sale. It's part of their contract with the industry. So for example, these the Newport sign here and the Marlboro signs that you see here advertising the price might be required by a price discount contract with industry reps. And so I know that can be a little disappointing to hear about these contracts, but one thing to note is that certain signs and advertising might not be covered by industry contracts. And that gives you a chance to focus on removing those signages and advertisements that aren't a part of an agreement with the industry. So for example, storefront signage often is not a part of industry contracts. Owners are putting it up there voluntarily. They think that it draws people into their stores. And this presents an opportunity for us to work with owners and explore other types of products and signage that will get people through the door and draw attention to the store. So with that background in mind, let's discuss how tobacco could be addressed as part of a healthy food retail program. One way that tobacco has been addressed in these programs is by restricting the amount or type of tobacco that retailers can carry. So for example, retailers participating in San Francisco's Healthy Food Retailer program cannot devote more than 20% of their selling area to tobacco and alcohol. As another example, under Philadelphia's Healthy Corner Store pilot program, retailers can qualify for additional incentives if they agree to stop selling flavored tobacco products, such as the nasty fruit and candy flavored cigars that are X'd out in this photo. And let's just X them out again for good measure. At least one store owner in that program voluntarily stopped selling tobacco altogether, noting that as a former smoker, she was concerned about tobacco's continued impact on children. Another way to address tobacco as part of a healthy food retail program is to ask retailers to reduce the advertising they display for unhealthy products. And several different approaches have been taken on that front. As part of the project plan that store owners complete to participate in healthy retail programs in Seattle and Spokane, owners are asked to remove all tobacco ads that are not a part of industry contracts. So for example, those big storefront ads that I showed you earlier. Or at a minimum, retailers need to make sure that these ads are at least 3 feet above the ground so that they aren't at kids' eye level. In New York City, a majority of store owners participating in the city's Shop Healthy NYC program agreed to remove all advertising from their entry doors. And finally, the thing I'll share with you is this is actually an after photo of a store in Burlington, Vermont that removed ads for beer and tobacco and replaced them with posters promoting active living as part of a healthy retail program. One of the things that we learned from doing research on working with store owners is that they may be more willing to remove unhealthy advertising if they're given something to replace it with that will attract customers' attention to their stores, such as the posters that you see on these windows. So hopefully this has given you some ideas for how tobacco could be integrated into a healthy food retail program. And I'll now turn it back over to Rio.
Great, thanks Malia. I especially like the use of the highlighter there. So for those of you who have questions for Malia about tobacco control, please feel free to type them into the chat box. She'll either respond in the chat function, or if we don't get to them, we'll include them in the Q&A at the end of the webinar. So now, finally, for our guest speakers, I'm very pleased to introduce Amy Abedili, Tony Maziarz, and Beth Deakins from the Eat Fresh, Live Well Healthy Corner Store Initiative in Toledo, Ohio. They operate a successful program and have some really neat opportunities coming up, which I'm sure they'll tell us all about. And as I mentioned at the beginning of the webinar, they'll talk about the nuts and bolts of their program, and then I will get to interview them and ask some juicier questions. So with that, please take it away.
Hello, everybody. This is Tony Maziarz. I'm a Creating Healthy Communities Grant Coordinator at the Toledo County Health Department, and I'll be joined with my colleagues, Amy Abedili and Bethany Deakins, and we're going to share the presentation. I'm going to cover the first several slides. So we're going to be talking about our Eat Fresh, Live Well Healthy Corner Store Initiative. It's basically what we do here in Toledo. Our story started in 2012 when we basically approached one store owner and convinced him that he should increase access to healthy food for the neighborhood residents in the store, and so that kind of took off, and he kind of helped the initiative to expand to other stores. And in our third year, we're doing actually 8 stores in 2014, and we're going to share with you our basically what we learned and what we suggest for other people that are doing something similar. So first, I want to cover what we consider a healthy corner store is. A regular corner store, and this is just a general definition, is basically a small-scale store that sells a limited variety of foods and other products. And there are many different definitions, and we just basically use the general version of that. A healthy corner store is one that we just take into another level, and they offer healthy options, including fresh produce. For many of you that are already looking into doing this next slide should be pretty self-explanatory, so I'll just go through it briefly. Why do we target healthy options to corner stores? So, typically they exist within a target community that we're trying to reach. Many of us are already working on grants or initiatives in the underserved community at different levels, increasing access to healthy food, increasing access to physical activity, those sort of things. So you want to go where your target is, so obviously corner stores is a good place to start. This is a place where people go to shop every day, so especially with their transportation issues, this is somewhere where they're going to patronize very frequently. So most are locally owned. Hopefully there's a good relationship between the store owner and the community, and you can usually see an immediate effect within the community once that's implemented. And again, it's a main source of grocery items in a lot of cases. I'm going to briefly go over our selection criteria for our project in Toledo. This is what we've learned in the last few years, so this will change, I'm sure, and probably add to the list as we see it here. So a good location obviously would be well patronized by the community. A family-friendly store just means that the community sees it as a safe place to go. We often will find this through our community assessment process, which Amy will touch on later on. We want, if possible, the stores to be located near neighborhood schools. We are currently working with some schools that are partnering with us on this initiative and helping promote this with their students. It's a win-win situation. It's helpful if the store already sells some groceries. Obviously, they're already used to doing this, so it's not going to be that difficult to convince adding fresh produce. We want to make sure there's enough capacity for the store to display fresh produce or whatever the healthy options we're asking them to display. And we want to make sure that they have the capacity to store extra produce so it lasts longer and they don't have to throw any away. We typically also would like for them to be WIC and SNAP licensed, so they can accept WIC vouchers as well as EBT vouchers. Typically, this is the best case scenario in our experience to have both, but currently we're working with a combination of some stores that have both WIC and EBT and some stores that are just EBT. But there are reasons why WIC are important, and we'll go into that later. If you can tie a personal interest with a store owner to this initiative, it's really, for us, it was key to kind of get this started. Starting a conversation even from the first day you meet the store owner would be important, especially with our first store owner. They had some health issues they were trying to overcome. This was a great way to convince them it would not only help them, but help the community as well. And now I'm going to hand it off to Amy Abadili, and she'll speak on some program steps that we followed.
Thanks, Tony. Hi, I'm Amy Abadili, and I'm a registered dietitian that works with Tony on the Creating Healthy Communities grant. And I'm going to talk to you guys about the steps we followed while we start to implement this healthy corner store initiative. The very first step that we find is important is the community assessment. And what we do here, we do this before we even agreed to partner with a store. And the reason for that is because if we find through our community assessment that it is not a family-friendly store, or that there's issues in the store or in the community, we don't really want to partner with them, because if people aren't visiting the store, then they're not going to visit it whether or not we put fresh produce in there as well. But what we really do with the community assessment, we go out into the community. We usually go to community centers or area partners and give them a survey. And the survey that we ask usually target the corner stores, and they help to identify the perception of the store in regards to its cleanliness, friendliness, price, safety, the likelihood of people actually buying the produce if it was in there. We also want to know if they're part of a WIC program or that they receive EBT vouchers. And then we also ask basic demographic information as well, such as age, income, gender. Try to just give an overview of the area. If we find after these assessments that this is a good fit for us, then we will continue on with that store. And as you can see in that photo right there, that is our first store that we did Safeway Market back in 2012. The next step we try to do is make sure that they increase their fruit and vegetable options. In our first store, they did sell fruits and vegetables. As you can see here, this is from Safeway. As you can see in the before picture, they didn't really have a lot of produce. And then in the after, that's what we provided them. But we want to make sure that they at least increase, if they are selling fruits and vegetables, that they increase 1 or 2 new options. And then in the stores that we worked with last year, they didn't have fresh fruit, so we had them actually bring in fresh fruit. What we have found that most store owners, but the ones that don't have fresh fruit have brought in 6 to 7 new varieties. So, that is very important. But whatever we do, we go in there and we talk to the store owner and come up with a plan with them. We don't tell them, this is the fruits and vegetables you're going to sell, but we talk with them and make sure to see which produce that they would like to bring in. So we work with them very closely. The next step that's very important is that we develop an MOU, or a Memorandum of Understanding, with the store owner. And basically it just highlights what we will be providing the store and what the store will provide to us, or what their responsibilities are to us for this to work. So, it's a very close relationship. It's a give and take. It's not that we're giving them everything and they're not doing anything, or vice versa. So once we come up with an agreement, then we both sign it so that we know what to expect from one another. For example, in this corner store, this is our Stop and Go stores from 2013. We agreed to provide the stand that you see there in the picture, along with the banners and some outdoor signage. And he agreed to make sure that he kept the produce looking nice and stocked, and that he wasn't using that stand for anything else but produce. The next step that's very important is the marketing and branding. That slide shows you the banner logo that we have, and that goes on all the banners and the outdoor signage. And that's very important for the produce and advertising it. We also provide them with outdoor signs near the entrance that promote people, so that people on the outside can see that they are a store that provides fresh produce, so hopefully that will entice people to come into the store. We also do community flyers in the area so people know that they are now a healthy retail store, media press releases, and then we also do a kickoff event. So those are the 5 main things that we do when we're talking about marketing and branding our corner stores. And then lastly, which is what we also think is a very important step, is the kickoff event, which after we've done all our planning, we've done all our community assessment, we've done all our advertising, then we do a big kickoff event. And at that event, it's usually a 2-hour time frame, and we go into the store and we have dietitians. In the past, we've had dietitians from the WIC department, from the health department, and they've done food demonstrations and had recipes available for the customers. We've done customer surveys to make sure this is something that they really want in their community and that they're going to buy the produce. We've also sent out press releases and had local news stations come and do a nice story on us that's been on the evening news, along with our Blade, which is our Toledo newspaper here. They've done nice editorials on us. And then, we also at our kickoff event have community partners, people that support this initiative and feel that it's very important. So it's a very good opportunity for the community and the customers, and they've been received very well. And then lastly is our follow-up assessment. And here in Toledo, what we do is we go out after the whole kickoff is done. We go back in 2 months, 6 months, and a year for a follow-up assessment at all the stores. And really the purpose of this is to determine long-term sustainability and to provide technical assistance. So we need to see, are they making a profit? Are they at least breaking even? Are they losing money? Are there any problems? And what can we help them with? And in the stores that we've done in the past, we have shown that, this is very beneficial. So now I will turn it over to Beth, who will talk about funding, outcomes, and next steps.
Hello everyone, this is Beth Deakins. I'm a LiveWell evaluator. LiveWell is a community coalition that works together with the Creating Healthy Communities grant here in Toledo. Funding sources for this initiative have been very small from the beginning, which is something unique about our program here. The Creating Healthy Communities grant has provided a significant amount of that funding to provide stands and signage for the stores. LiveWell Greater Toledo is the coalition that I mentioned, and we are funded through United Way of Greater Toledo. The Toledo-Lucas County Health Department WIC department has provided dietitians as well as food for kickoff events. And then the Stop and Go store chain, which is a local chain here in Toledo, has put quite a bit of money into this initiative and has really bought in and is working on transforming a large number of their stores. The biggest point that we want to drive home here is that this initiative didn't require a lot of funding. So if you're in an area where you don't have hundreds of thousands of dollars to work on something, this is still something that's totally doable as long as you make the right partnerships in your communities. So our outcomes for 2012 and 2013, which would be the first full year of the program, our produce sales doubled based on the WIC vouchers. That at the beginning of the program, that is how we were able to measure success. The stores did not have a point-of-sale system or a way to track produce in their stores. We're currently working on that with the owner of Stop and Go and one of the other stores that's been done previously. Other WIC voucher redemptions also increased as a result of adding the produce to the store because people were coming in and buying produce, so they were picking up other items while they were there. Stores that had been selling produce, as Amy already mentioned, increased the varieties of produce they sold, and those that weren't selling any fresh produce are now selling 6 or 7 different varieties. The store owners have seen a good return on investment here, and one thing that Tony already mentioned was getting that personal buy-in from the store owner, which has been very important here, and getting them to realize what they're doing is good for their community. Customers indicated that it's a benefit to their neighborhood. The stores are selling things that they want. The produce is actually going off the shelves. It's not going into the trash because it's been wasted. And the top sellers that we've seen here in our area are bananas and apples. So this map shows where the first 3 corner stores are, and then the 7 that will be kicked off this year are the green stars. As you can see from this, it's not focused on one area of Toledo. We really wanted to spread out across the city and work in all of the underserved areas. The majority of these, actually all of these stores, are near elementary schools in the local Toledo public school system. So we're hoping to make some good connections there and to help kids get on the right start early on. So the next steps that we've identified with our initiative here in Toledo is to work with communities to identify additional food deserts. People in the community tend to know their neighborhoods better than anybody else, no matter what an assessment tells you. So working with people that live in the neighborhoods and live in the communities is very important to identify their needs and to determine where we can expand to more stores. We're looking at expanding to the rest of the Stop and Go chain, as well as non-chain stores that are owned by individuals here in Toledo. We're looking to increase the capacity to gather sales data of fresh produce, like I already mentioned, with the point of sale system. Improving distribution access. We have been able to make a partnership between the Stop and Go chain and a local produce distributor to get a price break on the produce. One issue that we ran into early on was store owners having to go to local grocery stores and purchase the produce and then turn around and resell it in their stores so that they could get it at a reasonable price. Through the relationship that was developed between the produce distributor and the store owner, they've been able to get a price break and provide fresh produce at a decent cost to their customers. Another step that we're considering is developing a second tier where the stores expand their healthier options. And this could look like maybe putting shelf tags on healthier items throughout the store. So the wheat breads, the brown rice, things that are on the middle aisles that may be healthier options. Developing a working toolkit resource so that if we aren't here in 3 years, somebody can pick up a toolkit and say, this is how I can make my corner store healthier. And then continue to provide technical assistance. The goal of this project is to make it sustainable so that the businesses can do this on their own, but we want to be around to provide technical assistance and provide some of our experiences with them. At this point, I think we'll turn it back over to you, Rio.
Great. Thank you all for that really great overview of your program. I'm seeing a number of questions pop up in the chat box, which is fantastic. We'll try to answer as many of those as we can. But first, I'd like to talk a little about engaging store owners. So you mentioned personal buy-in multiple times, and you're in this very enviable position where you've completed your pilot phase, and now you're about to kick off 7 new stores, all owned by the same owner. And if they go well, then you'll be able to expand to more stores, also owned by that store owner. So store owners clearly seem key to your success. So what was key to developing those relationships?
Well, the first relationship we have, like we said before, Adam from our 2012 store was very key. He happened to know after he had saw some success with this, and it's still, we just visited yesterday and we saw him. He's doing great. Without him having buy-in and referring him to other community store owners through the Midwest Retailer Association, it would not have really worked as well as it did. So for us, it was a matter of hitting that personal note with the first owner and a chain reaction of some sort. There's a kind of domino effect that kind of got other stores to say, hey, how can I get a free produce stand, and all this free advertising? Because at the kickoff event, the media was there, the news was there, and hey, I saw you on the news, and I saw your store on the news. I would like to get that from my store, and that was really a key point. But it was to build that relationship initially that was a key to get into the stores working this year, because they all know each other and to some extent, and it just I don't know, I think that was very important.
And Amy or Beth, did you have anything to add to that?
I just think I agree exactly with what Tony said, but I also agree that we got those relationships because of Adam. But once we then got in the door with Dan, we had to make sure that we made that relationship with him. And and I think another thing that's really good how we work it is we don't go in there and tell them this is what we're going to do and you need to do this and you need to do that. I mean, it's a conversation. It's a relationship, and it's not like we're demanding them to do certain things. And I also think with what's a little different with our program than the bigger ones are, because we don't have a lot of money, we can't demand or ask the store owners to give up selling all their tobacco and all their pop and all their beer, because we're providing them, yes, with a stand, but we're not providing them with structural differences and making all this big changes like some of the other programs are. So we weren't that big of a threat to them. We're just asking them to make one little change, and with that little change, they see this great buy-in from the produce, selling the produce.
And that's a really great point, that all of these programs need to be tailored to the community and the store owner that you're working with. And so you mentioned that the chain store owner who you're working with, that he'll expand your program if it's successful. And so how does he, as a store owner and business person, define success? Because I imagine that what matters to him is going to be different than what matters to people like us who are in public health.
We actually have seen quite the opposite with him. He's been very on board with the program, and he's really bought into it. And he's viewing it as more of a service to his community. He is a Toledo resident, so he does see the benefit in doing something like this. For him, it's about not losing money. He doesn't care so much that he makes a huge profit. There's not a lot of profit in produce. But as long as he's breaking even and he's not losing money and the community is benefiting from it, he's happy with the program.
Great. That's actually a really interesting data point to know that, if you're approaching store owners, you don't necessarily have to be able to say selling apples instead of candy bars will yield this much of a profit, but it may be enough to say, you're doing something good for your community and you're not going to lose money this way. And were there any other thoughts there?
This is Tony Rio. Yeah, I just wanted to say that because he's a chain store owner, there's like 40 locations. The reason why I think that he was okay with the break-even strategy was because he was using the whole idea that he could get customers in the store, and if it brought traffic to a store, and this was more of a kind of a good feel initiative for the community, and they kind of, they basically, their opinion of the store has improved because of this. That was worth it to him, and I think that helped.
Mm-hmm. Right, and that actually ties in with what Malia was saying about how store owners often use the tobacco posters to bring people into the store. And you're saying that in your case, what appealed to the store owner was that your program would actually bring people into the store.
Correct.
So sustainability is a really hot topic these days. In almost every technical assistance interaction I have, we ultimately end up talking about sustainability. So can you tell us how you think about sustainability and whether there's anything you're actively doing to ensure that your program is sustainable?
This is Tony again. We're working on a lot of things that would ensure that funding would continue, including we're trying to develop a sponsorship packet for community members in our committee and other people that partner with us with other initiatives. If they want to have their name on the stand or something like that, it would give the opportunity for them for the store to get a free stand, but also not be reliant on our grant or funding that we may not have long term. Sustainability also comes in the idea that the store owner, like this chain owner, had said after the 7 pilot stores kickoffs are completed and after at least a quarter or 3 months of data come in saying that he at least breaks even, he will help pick up the cost of expanding it to other stores in his chain. So that's 2 examples of how we can sustain initiatives without just using our own grant funding.
Right, and
the toolkit that we mentioned also goes into the sustainability aspect, where we don't really need to be a part of a store owner deciding that they need to make their corner store healthier for their community.
Mm-hmm. Great, and what Tony was mentioning about this sort of tiered incentive structure, that's an interesting business model and approach where at first you're giving, say, a stand or something that's relatively low cost, and if that works, then you work with the store owner to make more changes. But in that round, they actually have to put some skin in the game, shed out some of their own money. So that's really interesting. Now, a lot of people I talk to also want to know about timelines. So how long did it take you to actually engage the store owners, and then how long did it take you to see changes?
Well, when we talk about our first store, since that was our pilot and we were new to it all, the way we got our first store owner, we were working on a different initiative, and we had asked them because they were in the neighborhood if they knew any corner stores. And so she gave us the name of this corner store, and we went in there. When we went in there, we just briefly introduced ourselves, talked about what we would like to do and if he was interested. And we didn't really push the issue. We just gave him information. And then, 2 weeks later, we came back and followed up. But from that time, that first initial meeting and the follow-up, all the way to the actual kickoff event, was probably a good 6 months, 6 to 7 months. Because, at first when we went in there, he was like, okay. And then when we followed up, he was kind of leery of it, like didn't really know if he should trust us or if this was going to work, but he would try it. And then, it took us time to make sure that we had the stand and what we were going to do and the marketing, because that took the longest part, because you got to, you have to plan it all out. You have to be with him and talk about his project plan and his goals and make sure that you're fitting it towards his store and his needs. So like his store is different from Stop and Go's, and Stop and Go's will be different from somebody else. So we really tried hard to work with him and be there for him and do the technical assistance. And then, the end result was the kickoff. So we probably started from start to finish 6 months. Now in Stop and Go, it was probably about the same time because we had to meet with Dan, the president. And what was different with Safeway versus Stop and Go is Safeway was one owner. So whatever he decided, that's what we did because he was the owner. Whereas in Stop and Go, since it's a chain, it's a top-down approach. So here's the president, but yet every store every so many stores has a district manager, and then they have a manager. So it took a while for all that to come down through the chain. So that's why it took us about the same amount of time as well. So it just kind of depends on who you work with, but I would say on average you're talking a good 6 months.
Okay, good to know. And I want to move in now to questions from the audience. There are a number of questions. One big theme that's coming up is data. What type of data are you using to actually track these sales? Did you use coupons ever? How are you evaluating, and what are some of the indicators that you're using?
I'll start this conversation. This is Tony. Basically, what we wanted to make sure initially is that our stores accepted WIC, and the reason is because, one of the reasons is because without any other way to track data, we could at least find WIC data pretty easily by just going back into the system and contacting the WIC office or whatever. But we were able to track, but month by month, comparing to pre-kickoff status, that the store has increased number of sales according to WIC. Now that doesn't take everything in consideration, only WIC, but it does indicate. It is an indication. It is a measurement that we did use. So that's the data we've been using up to this point. Now we are now asking Stop and Go chain, which we are kicking off all of the stores next week, as a matter of fact, to put in buttons, produce sales buttons on his cash registers to be able to track all the produce sales, and then that will give us more accurate measurement long term. And I think that's the way that he's going to determine whether he's losing money, breaking even, or making a profit. So starting out with WIC and then register button would be our better transition.
Okay, and is the Stop and Go owner paying for the point of sale system?
Yes, he is. It was definitely a timing issue for us. he was already in the process of changing over his registers right prior to us kicking off. So it happened to work out that, while they're doing that, they can just add a button, so it wasn't a problem.
Got it. We also have some questions about produce sourcing and distribution access. So can you talk, I know that you mentioned that you're working with distributors to decrease the cost for your clients, but can you talk a little more about what that process is like, as well as what your store owners are doing now before you actually get that deal?
Yeah, sure. This is Amy. In Safeway, what he does is he goes out and tries to find the cheapest produce he can, whether he goes to Aldi or Kroger's, which is a grocery store here, or a farmer's market, and he buys it there and then brings it to his store and sells it at a reasonable price to his customers. And the reason he doesn't work through a distributor per se is because he doesn't need large quantities of it, so he can't get the price break as like a Meijer or a big store could. So he finds it easier just to go out and buy the produce where he can get it cheapest, and so that he can sell it to his customers without overcharging them or charging too much. Now Stop and Go, the 2 stores that we did in 2013, they did it the same way, where they went out and each of the stores went out and bought their own produce where they could find it cheaper. However, now that we're kicking off the 7 stores next week, Stop and Go is working with a local distributor, Sam Oken, to actually provide produce to the 7 stores, since they are going to be buying in larger quantity. They're also going to be delivering 4 times a week to the store, so it's going to keep it up and fresh. So what we have found that obviously the more stores you have, it's easier for that chain or those stores to work with a distributor, whereas if it's only a one store owner, it's just more beneficial for them to go out to the stores. However, down the line, our group would like to try to figure out something where all these little stores can go to a central hub or central location and get those discounts. And hopefully we can work with the distributor that we're working with at Stop and Go to accommodate all the little stores. But we're not really at that part yet, so that's pretty much how it's working right now in Toledo.
Okay, got it. Now let's talk a little about displays and marketing. So we have one question asking who made and provided the store displays, and another question about whether you've had any issues with store owners not wanting to bother with any of the signage that you give them.
This is Beth. I'll take that question. We actually, when Amy was talking, I don't know if anyone noticed, but in one of the slides it showed what our old branding looked like, and then she showed a larger image of the current marketing and branding that we had a graphic designer work on out of Columbus. That is new with this initiative as of these 7 stores that we're kicking off, but we're going to go back in those other stores and change it so everything looks the same. And we have not had any issues with store owners not wanting to use our signs. Pretty much everything that we've given them has been put up in a place where we've agreed upon. I think it helps that it's in our memorandum of understanding that the signage that we give them has to be displayed in a visible place. So we haven't encountered that issue.
Okay, good to know. And then a number of people are really interested in the community assessment tool that you used. Is it possible to share that, or do you have any suggestions of places that folks could find a similar assessment tool?
Yeah, we can send a link to what we use. I mean, we can send you the attachment, and if you can send it out. But what we did basically is, if you go to any of the big corner stores like Louisville, Philadelphia, Minnesota, a lot of those places have evaluation surveys as well that they do in their stores. And basically what we did is we took a bunch of those questions and kind of made it into our own. So we'd be more than happy to share it however you want to do that. That's fine.
Okay, great. Great. I think we'll be able to send out a link. That's fantastic. Thanks. Okay, so more produce questions. We have a couple questions about whether you work with local produce at all. Do you source from community gardens? Do you source from any local farmers? Have you thought about that?
The produce distributor that we're working with, being in Northwest Ohio, we have a somewhat short growing season. But the produce distributor that we're working with does get produce from local farmers during our growing season here. So as far as that's concerned, the new relationship that we've created with Stop and Go and the distributor will provide locally grown produce.
Okay, great. Great. So we have just a couple minutes left. I want to wrap up the Q&A portion by asking if there are any sort of last lessons learned, best practices, or tips that you'd like to share with our audience.
This is Amy. For me, I think the most important thing is with this whole initiative is building a relationship with the store owner. I mean, making sure that it's a give and take, and you're not just telling them what to do. It's a relationship and it's a friendship, and that they trust you, because if they don't have the trust, if they don't think what you're talking about is going to happen, or they have any doubts, it's not going to work. So I think the most important thing is to get those relationships strong, and to make sure that you have that relationship and that you have open communication, and that they know that you're available if they have any problems or they need help, and that you're just not there to do one thing and then you're gone. I mean, like Tony said, our first kickoff was in 2012 with Adam, and we still just stop in and say hi to him and see how things are going. And so we have that good relationship with them, and that relationship will then help to grow other business later on.
Great. And thoughts from anyone else about best practices, lessons learned?
The one thing, this is Tony again, that I wanted to highlight was that you don't have to, like Amy said this before, you don't need a lot of money to start this program if you're concerned about that. So we basically leveraged a lot of marketing, a lot of other things that are not necessarily quantitative, but they're qualitative factors in trying to roll this out. So there's value in those qualitative things as well as just money or stands or things that you buy. So just being there for the store owner and providing as much marketing and as much be available to them on the phone for questions regarding WIC applications or whatever is there. Try to be that resource, and it's more likely that they'll work with you and continue to work with you.
And then my last thing, Rio, is that I know we talk about a WIC provider and that, and if you're just starting out and and you've never done it before, having a WIC is not the end-all, be-all of starting a corner store, but it is very, very helpful if it's your first corner store and something that you're just trying out. Because, like Tony had mentioned, with WIC, there are certain requirements that they have to have in their store. One being fruits and vegetables. Now, it doesn't have to be fresh produce, but you do have to have some. So they already know that there have to be requirements. So bringing in fresh produce wouldn't be as big of a deal for them, because they need to supply some kind of produce, than for somebody who doesn't have WIC in their store. So it might be harder for those. Not that you can't do it, but if you were starting out for the first time and wanted a little help getting on, it would be better to start with stores that have WIC.
Great, thank you. So we just have a minute left. So I'd like to just share with everyone the rest of our Healthy Retail webinar series. The next one's on May 20th, and my colleague Christine Fry will be talking about finding federal funding. This is a look at some resources that we talked about today. I know a lot of people had questions about produce, and there's a link in the chat to a new resource we released called Providing Fresh Produce, Distribution Challenges and Solutions for Healthy Food Retail. And then finally, This is my information and Malia's information. I know there were a number of questions that didn't get answered today, so please feel free to follow up. We're happy to direct you to Tony, Beth, and Amy. And I'd also like to wish Tony, Beth, and Amy good luck with your kickoff next week of 7 stores. And with that, have a really fantastic Tuesday. Thank you.